Should you be drinking more cranberry juice if you just found out you had kidney disease? Stay tuned to find out. Thanks so much for watching. Make sure you subscribe to my channel, hit the notifications button, hit that bell so you never miss a new recipe or a new health tip. My name's Dr. Blake Schusterman. I'm a board certified kidney doctor and I'm also the cooking doc. Thank you so much for watching this week. Now, if you watch every week, you know that though I am a kidney doctor, I am not your doctor. Well, I'm not most of your doctors. So make sure you discuss any health changes, medication changes, diet changes with your regular physician, nurse practitioner, physician's assistant, etc., etc. So when people come to see me in the office, they often tell me the same thing. I've started drinking a lot more cranberry juice since I was told I have kidney disease. Does that work? Let's talk about it. So cranberry juice and cranberry supplements have certainly been studied extensively for their role in preventing urinary tract infections. The data on it is actually pretty mixed. There are some studies that find that having high-dose cranberry supplements can limit the amount of urinary tract infections for people who are at high risk. There are other studies that show that it probably doesn't make a difference for most people. There is some physiologic possibility, like a reason for this, because there are some compounds in the cranberries that may work to prevent urinary tract infections from occurring. But I think for the most part, people who would get benefit from that need to either drink so much cranberry juice or to take so many cranberry supplements that they will have side effects from either one of those things before they get to a level where they can actually have a benefit where it prevents urinary tract infections. So here's the other thing. Taking a lot of cranberry supplements or drinking a lot of cranberry juice to possibly get an effect for urinary tract infections doesn't do anything for your kidney function. Your kidneys are filled with all these tiny little filters called glomeruli, and those filters get rid of waste products in your body and they keep the blood level balanced in all kinds of ways. And cranberries have zero effect on those filters. The reason that's important is because those filters are the things that determine how well your kidneys are working, what your kidney function is, what stage kidney disease you have. And we know for certain that cranberries have zero effect on that. So if you are thinking about taking cranberries to help protect your kidneys because you have chronic kidney disease, then you can stop right now, because I can tell you with certainty that it will not make a difference. Now, there are lots of things that you can do with your diet to help your kidney disease. I've tackled them before on other videos, but quickly things are getting rid of your sugar-sweetened beverages, managing your diabetes, lowering your amount of animal protein, eating less sodium, eating more fruits and vegetables, eating out less often. So there are lots of things that you can do with your diet to help protect your kidneys, but drinking more cranberry juice or taking more cranberry supplements definitely isn't one of them. Thanks so much for watching. I'm Dr. Blake. I am a kidney doctor and I'm also the cooking doc. Make sure you check out my website, thecookingdoc.co, to learn more about kidney disease, and make sure you subscribe to my channel so you never miss a new recipe or a new health tip. And we will see you next time.